वक्ष्यसि ददासि यत् तपस्यसि कौन्तेय तत्कुरुष्व मदर्पणम। સનાતન ધર્મનો મૂળ ભગવદ્ ગીતા એના 9મા અધ્યાયમાં ભગવાને વિશ્વની સેવા જનતા જનાર્દનની જે એ સૂત્રાત્મક રૂપે આપણને ઉપદેશ આપ્યો. ઉમિયાધામ એડિસન અને વિશ્વ ઉમિયા ફાઉન્ડેશન એની અમેરિકાની શાખામાં સંલગ્ન એવા પ્રત્યેક વ્યક્તિએ ખભે ખભો મેળવી ભારતમાં વકરી રહેલી આ કોરોનાની મહામારીના વ્યાપક અને રૌદ્ર સ્વરૂપને ડામવા એક થઈ અને નાણાકીય સહાયની સાથે શસ્ત્ર અને શાસ્ત્ર આ બધું જ ભારતમાં વસતા પોતાના જ ભાઈઓને આપવા માટે કમર કસી અને એના પરિપાક રૂપે માતબર રકમ એકત્રિત કરી ભારત સરકારને અર્પણ કરી, ગુજરાત સરકારને અર્પણ કરી અને ઓક્સિજનની કમી એને નાથવા માટે પણ સાધનો ઉપલબ્ધ કરાવ્યા અને આ કોરોનાની મહામારીને નાથવા માટેનું જે એક વિશ્વનો યજ્ઞ છે એમાં ઉમિયાધામ એડિસન અને વિશ્વ ઉમિયા ફાઉન્ડેશન સંલગ્ન રીતે કાર્યરત છે અને રહેશે. એના નિમિત્તે આપ સૌને ઉભય શાખાના સદસ્યો વિશેષ માહિતી આપશે. સૌને જય માતાજી.
Okay, Hindi or English?
Everybody to take care about this.
Yeah, everybody should speak in English.
यत् करोषि यदस्नासि यज्जुहोषि ददासि यत् तपस्यसि कौन्तेय तत्कुरुष्व मदर्पणम. विश्वरूप भगवान नारायण ने गीता के माध्यम से सनातन धर्मियों को ये संदेश दिया, एक दूसरे की सहायता, जनता जनार्दन की सेवा. आज पूरा विश्व जब कोरोना महामारी के इस भयानक खप्पर में डूबा हुआ है, तब विश्व उमिया फाउंडेशन ऑफ यूएसए और उमियाधाम परिवार एडिसन दोनों ने कंधे से कंधा मिलाकर अपने भारतवर्ष में रहे हुए परिवारजनों को, मित्रों को, राष्ट्रजनों को जिस प्रकार से सुविधा प्रदान कर सके उसी प्रकार से कमर कस के आर्थिक सहयोग और संसाधनों की उपलब्धि कराने का एक विश्व यज्ञ आरंभ किया. दोनों शाखा के सभी भक्तों ने, सदस्यों ने मिलकर सब प्रकार से धनराशि एकत्रित करके सरकार के द्वारा आयोग और उससे संलग्न संस्थानों के माध्यम से जनता जनार्दन तक पहुंचाया. साथ में धनराशि के साथ ऑक्सीजन इत्यादि की जो कमी थी उसके लिए भी संसाधन उपलब्ध कराए. आज उसी विश्व यज्ञ, सेवा यज्ञ के उपलक्ष्य में दोनों शाखाओं के सदस्य यहाँ उपस्थित रहकर समाज को ये जानकारी देने जा रहे हैं कि किस प्रकार से कंधे से कंधा मिलाकर ये यज्ञ हो रहा है. तो आइए हम सब माता महामाई को प्रार्थना करते हैं कि इस यज्ञ में जुड़े हुए सबको शक्ति प्रदान करे और जो इससे पीड़ित है उनको जल्दी से राहत मिले, समाधान मिले, ऐसी कृपा हो. सबको जय माता जी.
Before we start the press conference, we'll go back. Yes, before we start the press conference, I really like to thank TV Asia, ITV Gold, and Masala Junctions. As our Sastri explained you that there is a dire need for my organization, which is Umiyadham Edison, New Jersey, and we have a sister organization back in my hometown, Vishwama Foundation. And the request came in when this coronavirus was after the March. It came in a second wave, very strong. We got a phone call from our brothers and sisters back in India that this country needs the help. And the biggest things we all know, pranavayu, oxygen wasn't there. Not a second thought even, my organization, you can see the entire team and many more that part of this Umiyadham Edison. We took a step right away. We took it very urgently. We treated it at the highest level, and we try to work to defeat this coronavirus that spread it very deadly in India and especially Gujarat. With that, actually, all of the you can see that all my brothers over here, they're part of our board of Vishwa Umiyadham as well as the Umiyadham Edison, New Jersey. We will today operate. Everybody will update you how we have come together, how what the Umiyadham Edison is a temple, and as a society, and also as a healthcare, how we are going forward. So with that, I'm not going to take much more time, and let me introduce to our president, Arvind Bhai Patel. He will briefly describe what is the Umiyadham Edison, and then actually we will go with line by line with all the members. They are sitting over here, and they will introduce about this Mahamari, as Sastri said, that how we come, how Umiyadham Edison helped the local community as well as the community back in our own home country, Gujarat and India.
Hello, my name is Arvind Patel, President of Umiyadham Edison. Our Umiyadham Temple is in the heart of Edison, Oak Tree Road. We celebrate all Hindu festivals.
I think we should. Yeah, President actually briefly described about our temple and its activities. I will ask Harshad Bhai, which is our Vice President. And Harshad Bhai is not only a Vice President of this temple, but is also an Executive Vice President of Indian Business Association. And you see that this is an Oak Tree Road where all the businesses are thrive. So I will ask Harshad Bhai to update how our temple started.
Okay, thank you, Atul Bhai. Temple started, like corporation started 2013, and like a member starting like 10 members, 15 members, 20 members. Then temple site find out in 2017. Then is a Bhumi Pujan is 2017 too also. Then 2019 get the Pran Pratishtha, and finally like a temple built it and started, one section started in 2019. This is a base on Edison, basically looking for the location. Why? Because of Indian community here, Indian market here, and suddenly coming to market this property and find out and jump it basically and get this property. And everybody knows as a TV Asia, Masala Junction, ITV Gold, and everybody is covering every time supporting our temple, and I'm really appreciate and this temple for everyone, every community, and always welcome to this temple. And temple always helping the vaccine and oxygen, supporting from India, Vishwa Foundation, and all the time temple like to work together, all community. And please come to temple and join the temple. Everybody is welcome here. Thank you so much.
Arshad Bhai did explain how our organization has started from 2013, 17, and today. We have from 2013 until 2020, we are lucky to have today our past president, Baldev Bhai Patel. Under his leadership, actually, all these things, the temple, we acquired the land, we built the temple, and we did the Pran Pratishta. So I will ask Baldev Bhai, our past president, to go over what we have been doing over the last 5-6 years about all the activities and festivals. So I will ask Baldev Bhai to come.
Umiyadham ki jai. I am Baldev Bhai Patel, past president of Umiya Parivar. We started our temple in 2013, and that time so hard to find out the people to work as a volunteer and the other things. But fortunately, our community helped a lot, and we start our temple in 2013. And after that, every year, and we celebrate all festival in our temple. When our temple started in 2019, we do the Pratishta, and after that we do celebrate. Diwali is most nice program, New Year Day, and the after that Mahashivratri, they happen the Navaratri. That's our big festival, the 9-day we celebrate, and people, thousands of people, they come and take advantage of them, and we are so grateful for our community. They are help a lot, and we do everything good. So we think the Vishwa Foundation also they're doing good, and we are supporting them. And TV Asia, TV Gold, and Masala TV, they are supporting all the time, and we are thank you for them. Thank you.
As our past president said, about from 2013, we celebrate each and every festival with jest and jill. Before even Corona started, in a holy festival, we used to get almost 2,000 to 3,000. So as you can see, that there was a big need for community to have a temple right in Edison. And as Arshad Bhai said that's why we chose Edison as a center for our temple. We will actually have now our Executive Vice President, Mahendra Bhai Patel. He will go over actually what we have done so far as a construction project and what we're gonna do next.
Thank you, Atul. Mahendra Patel, Executive Vice President, Shri Umiyadham, Edison, New Jersey, and Chairman of Vishwa Umiya Foundation, New Jersey chapter. As previously mentioned by Baldev Bhai, Atul Bhai, and Arshad Bhai, means we started the construction of this temple in 2017, and within 2 years, we were able to complete the project of the temple phase 1, and we opened up the temple in 2019, and since then, the community has responded very well. Like we have every day almost 200 visitors visiting the temple and helping the temple to grow. As our need grows and as we see like during some functions also, we see like, there is a need for larger rooms. So in second phase, we are going to have the community hall we are going to build up, which has a capacity of almost 1,000 people. And our priority is to make this temple to look like a temple. So we are going to have the facade restorations done throughout the surrounding of the temple. And we are going to have the 3 shikhars on top of the thing. So even the people are traveling on the Octree Road, they can see visually, visualize that there is a temple in nearby. So we really appreciate the support of the local communities and the residents of Edison, Piscataway, Woodbridge, Iselin, and thank you for your support. As a part of the Vishwa Umya Foundations, my fellow speakers will talk about that what arrangement we have done from this Edison here in New Jersey and all the members in the United States, they came together from 15 United States that we combined together, and how we helped Ahmedabad to supply the oxygen cylinders. Thank you.
In the beginning of the press conference, Arvind Bhai appealed the Piscataway, Edison, and Woodbridge community to come forward and help us. And you, as Mahendra Bhai said, why he said that? Because we have a long way to go. We're not even 40% done. We need to have a temple look like temple. We need to the shikhar and also the community hall. So that's why actually President made an appeal that guys, come, let's work together for this project. Now I will give an update on a COVID, what this temple has done. In mid-March actually, when the vaccination program started, we saw there is a vast need in our Edison township for a vaccination. We knew that it's very hard to take an appointment for a vaccination. Even though our Indian community over here, they speak Gujarati, they hardly speak English, and they have no way to go to get the vaccination, even though when government declared that anyone can take a vaccine 65 plus. At that time, this temple actually, and we have fellow member over here, our treasurer, Kanubai Patel, he actually made a few phone calls. He know the relatives that actually work in a Rite Aid. So he was able to successfully, we have a Rite Aid New Jersey coordinator, Jayasri Patel. He actually came forward and decided to help us. In a mid-March, when COVID vaccine is scarcely available or hardly available, there is no way for Indian community to go and vaccinate it. At that time, this temple actually scheduled a first vaccine drive, and we gave a first shot in a 316, more than 60 to 65 plus years old community members, a first shot, and they felt very relaxing on that day. After that, as you know that, we actually administered the Pfizer vaccine, and Pfizer vaccine requires second shot in a 3 weeks. And on a first day, when we had announced this vaccination program, more than 1,000 people came in. Unfortunately, we only had a stock for 325 people. We administered second shot in a 3 weeks. After that, our treasurer, again, Kanubai, reached out to Jayasri Patel that we see there is a better need for more vaccination, and Rite Aid, with Jayasri Patel's recommendation, came forward. And 2 weeks before, we gave a shot for 416 shot for the community people. So, and the second shot for Pfizer second shot is scheduled upcoming Sunday. So overall, we actually vaccinated more than 700 people. During the second shot, actually, we have scheduled almost 400. However, more than 125 people, even though they had appointment, did not show up. At that time, our Vice President, Harshad Bhai, actually had an idea. Harshad Bhai always comes with an idea. He decided that why can't we actually vaccinated our grocery stores in a neighborhood? And Harshad Bhai actually dial up the number, all the local grocery stores, and we vaccinated more than 100 actually employees of this nearby grocery store, so you can safely shop in that thing. So as you see that, and at that time, it's not only our community. We know that our grocery store is very Hispanic community, Latinos community work actually, and we vaccinated them as well. So this temple actually, all the time, when there is a need for a medical, we have 4 doctors in our board, we always talk, and we come up with a better idea. So we actually successfully, we did a COVID drive, over 700, and hopefully we have second shot for a Pfizer this coming Sunday. With that, actually, I will turn over there are 2 reasons for this press conference, right? TV Asia, ITV, and Masala, they always cover all our festivals. But why we are here today? Number 1, the COVID vaccine that we did. We also do many other camps. But second thing, that we help our brothers and sisters back in Gujarat. And I will ask Dinesh Bhai Patel to come forward. Dinesh Bhai Patel is actually a co-chairman of the Vishwamaya Foundation and Maryland chapter, and he also is the board of trustees of Umiyadham Edison. So I will request Dinesh Bhai.
Thank you, Atul Bhai. My name is Dinesh Patel. I serve as here in Edison, New Jersey, as regional vice president. Also, I'm chapter chairman of the Vishwamaya Foundation. When pandemic began, second wave was a disaster. And with the guidance under our honorable president for Vishwamaya Foundation, Sri R.P. Patel, vice president Sri Deepak Bhai Patel, and team, also in US team, our chief coordinator Sri Rasik Bhai Patel, Ajit Bhai Patel, vice president Sri VP Bhai Patel, JP Bhai Patel, also Vijay Bhai in Florida. With the guidance of all, we have begun with this shortage. We received the call from Honorable President Sri R.P. Patel and discussed how we can help with this oxygen shortage. In entire team in US, we got jointly together, try to see there was a shortage because how we can find this oxygen concentrator. So first of all, with the guidance with our all leaders, we accommodate and put together over 1,400 oxygen concentrator. And we have already 2 shipments, already went to that India, 250. That is not just for Ahmedabad. They decide to support entire small village to big city in Gujarat. So they already serving and sending all this oxygen concentrator to that in small village to the big hospitals and every place as needed. We have also lined up that consignment is going every other day from US to Ahmedabad. We have passed 380 oxygen concentrator to the small to big, many organizations they're serving with this necessity timing. Vishwamaya Foundation has begun 120-bed hospital to respond to COVID. Also, our 2 big donors has showed their generosity and showed that modern ambulance that accommodate modern facility with his ventilators, and that patient can survive more than 8 hours within a van. So it means to save the life that one can do everything is needed. On top of that, Vishwamaya Foundation has begun that oxygen bank to giving their all cylinders to that places, villages and more hospitals to giving. So they are doing really great job. In behalf of Vishwamaya Foundations and all temples and Jagat Janani Ma Umiya devotees, I'm thanking everyone who support and show their generosity. Without their support, it would not be possible. Further discussion for our organizations and temple, I will request my colleagues will give you more brief. Thank you.
As you see that virus, second wave virus in Ahmedabad came very strongly and took lives of our loved ones. And at that time, as Dinesh Bhai explained, that we couldn't sleep over here. Any of us, or in a New Jersey or anywhere in USA, we lost our slave. What's going on in India? And at that time, the Vishwamya Foundation made a call to all of us, and as Dinesh Bhai explained in detail, that we on that day we woke up, and how can we do the necessity for oxygen concentrators? And as you can see, in a short period of time, and definitely blessing of Jagat Janani Ma Umiya, we could shift in a larger quantities in India. Many organizations were trying, but they couldn't do that. But with blessing of Ma Umiya, we could have done that. Now actually, we will ask, as I before also mentioned that in our board, we have 4 doctors. I'll ask Dr. Manubhai Dadania to give the details that what our temple does for a medical necessity, and he does a lot more other activities and help in a community as well.
Thank you, Atul. Just to go ahead and to tell on what Dinesh Bhai had said about the COVID current crisis in India. When our motherland was on the knees and we were losing all our relatives left and right just for the lack of oxygens, Kadwa Patel Samaj of North America, which is a Saurashtra-based organization, in association with many other organizations like Umiyadham, Vishwamya Foundation, Vallabh Youth Organization, VYO, and many other organizations work together to make sure that every area of our, where there is a need for oxygen concentrators, where is a need for any other medical needs for the COVID, we all sprung into the action, and KPSNA raised about $600,000 and again sent oxygen concentrators mainly to Saurashtra, and we have already distributed in 19 COVID care centers, primary care health centers, and the CHCs also, and they are all already functioning, and there are more on the way. Oxygen was just the one need that we were trying to provide, but additionally, there was a lot of other needs which community needed. As Dinesh Bhai said, there was a need for ambulances to transport the patients. So we have provided additional ambulances to run into the Saurashtra region. We have also, there are a lot of poor patients who are going into the government hospitals. Unfortunately, they have beds, but there are no medicines. They can't afford to go, and medicines are not available. So we had also made arrangements for those poor, unaffording patients to give them whatever the necessary medicines they need to take care of the COVID, and by the time they can survive. So we are providing medicines to those unaffording patients who are in dire need of those medicines. Along with those medicines, socially there are more issues also. There are patients, because of COVID, they are not able to feed themselves. So we have also partnered with local food banks in India, especially in Gujarat and all other regions, where we are providing the prepared foods to those of that who are affected, who are not able to feed themselves. And we are also providing grocery kits to those who are coming there so that they can go home and cook their foods also. So we are trying to coordinate in a way that we are trying to reach every aspect of the lives which has been disrupted by this COVID pandemic. We are also trying to distribute COVID kits, COVID testing kits wherever, so that at least if somebody finds out that this person has a COVID, they can isolate and they don't spread further. So we are distributing free rapid COVID test kits to all these places where there are more people around, so they can isolate and we can stop the spread of the COVID disease. Additionally, in India, there is a significant shortage of doctors. And all these doctors who are not used to take care of these complicated COVID things, they are all doing their job, but they are not able to do it efficiently because they don't know these things. So we have also organized that there are expert physicians from US who are in regular touch with those physicians in India, and they are giving them the education about what to do and what not to do for the COVID. So we are kind of all these organizations combined together We are trying to, take this COVID-19 heads on and make sure that that does not, cause any additional damage to our motherland. So that about COVID. I'd like to come back to this Umiyadham, which is a beautiful, magnificent, temple here in the heart of our Indian community. This is not only just a religious place. When we had this organization formed, we always thought that, okay, religion is part of it, and that's our main goal, but at the same time, we need to be cognizant about social activities, educational activities, and also the charitable activities that which can certainly benefit the community at large, not only here, but everywhere around also. So Umiyadham is taking up all those different activities along with the religious activities also. I'm being a doctor, I'm always looking for medical needs. As Atul mentioned, that when we had those COVID vaccine drives, there were long lines where all these people around from here who don't have any resources, they were lining up to get the vaccine. So along the same lines, we are planning to give education to the community for all the common diseases. We are also planning to provide like other vaccinations like flu vaccinations, pneumonia vaccinations to those patients who do not have access to good primary care, who don't have insurances or so. So we are trying to cover overall humanitarian cause with the Umiyadham. As a part of that humanitarian cause, Umiyadham has also partnered into a program which is called Smart Sticks for Blind, which is the program which has been taken up by Vallabh Youth Organization known as VYO. And briefly, we are trying to provide smart sticks to those people who are visually challenged or blind in India. And our goal is to provide those 100,000 sticks to all these people who are in need. By providing them stick, we are providing them a hand. We are becoming a sarthi for them because it's almost a hand. And Umiyadham has proudly partnered with VYO to provide and raise additional funding for that, and we will provide more information about that also. Thank you very much.
Yeah, Dr. Manubai actually went a Umiyadham at large. It's not the religious. We actually serve the needs, socially, medical needs, as well as religious needs. And I just want to go back to this temple actually. This temple is built on a 5 or more state trustees, right? So I like to thank also all the trustees from New Jersey, New York, Pennsylvania, Delaware, and Maryland, and many other, we have trustees all the way up to the South Carolina and Detroit. So this temple actually is grateful to all the trustees. As we always, when we were initially were thinking, and the question always came in, why temple? Many people, a lot of people ask, why temple? Why can we do this? And now you can see that the temple is not just a platform. We could do a lot more activities. We could do a lot more social activities. We could educate the people. We could serve their medical needs. We could serve their immigration needs, and we could do a lot more things. And today, actually, our chairman, Mr. VP Vishnubai P. Patel, he couldn't be here, but I will have a Dr. Kiritbhai Patel, actually. He is a prominent doctor in Edison Township, OBGYN, and most people know actually him very well. I will ask Dr. Kiritbhai Patel to tell you next time why temple in Edison.
Jai Mataji. I'm Dr. Kirit Patel. As Atul Bhai introduced me, I'm a practicing gynecologist and obstetrician in Edison. I'm a vice chairman of the Umiyadham Edison Temple, and I'm a chairman at JFK Medical Center in Edison. As Atul Bhai said, there are multiple reason and activities that is done out of temple. Manubhai explained very nicely what we do medically to provide help here locally and to the motherland. The Umiyadham Edison provides the platform for the young generation for their spiritual and cultural growth. And we have a talented professional amongst our members representing all walks of life. And for the young generation, we provide the shadowing and mentoring for different specialties that young generation is looking for, whether it is good for them or not. We provide the mentoring for it. If somebody needs a guidance, we have a professional can help them to expose them to a different specialties. So it is the platform which is needed for the young generation to connect and grow under Umiya Mataji's blessings and umbrella. Thank you very much, Dr. Kirit Patel.
With that, actually, we got the entire update of our temple, its activities, its involvement here and abroad, and Vishwa Umiya Foundation's goal to build a 1,100 crore rupees, a Vishwa Umiya Dham, which gonna be a landmark in an entire country and also foreign visitors. I appreciate again the TV Asia, ITV Gold, and Masala Junctions for participating in today's press conference. As previously said many times, you always help us, you always help propagate our agenda to the local community. We cannot be thankful more and more. We always thankful to all of you guys. Thank you.